Is that comfortable?
Yes.
You're fine. So the knee, start with the good one. The knee only wants to do this. It gets really upset if you twist it even a little bit. Well, and if you can't do this, if you can't touch your foot to your butt, then your quadriceps are short, and that makes the meniscus, the main joint tissue in your knee, like a nut in a nutcracker, right? Because you've got these two long levers. Every time you squat and come up from a squat, stand up from a chair, you're just crushing that tissue more than you otherwise would. So I show people a lot of times, people that are really tight. I've been talking all day. How many reports did I do today? 4 or 5. I promise I'm not diabetic. So yeah, so some people are really tight, can't even, like, so most people only know to do this, right? Which is fine before warm up, to stretch like this before a run or whatever. It's not going to make your quadriceps longer over time. So depending on, yeah, we'll have one of you do this as a way to stretch that anyone can do, no matter how tight it is. So is there any pressure is there any pain in the knee when I do that?
No.
That's fine. So you can see that's about as far as he can bend his leg. So we'll show you the quad stretch too. You'll be a good model for that. So the quadriceps on the front of the thigh, overly compress that. You can let that back down, just like that with the foot on the table. The hip rotators are up here in the upper glute area. They're kind of cut off here, but piriformis goes directly from the thigh bone to the tailbone, to the sacrum, base of the spine. The sciatic nerve goes right under that, so it's a common cause of sciatica, just having that muscle tight. And then there's a glute medius and minimus that are under the maximus. So they're all kind of cut away, but they're all muscles in an upper glute area, and they basically turn your foot out. So if you're a soccer player or a ballerina, you might use that muscle a lot. If you're not, you probably never use it. When you sit in chairs like this all the time, those muscles get even less movement, and they get shorter and shorter and shorter. So how do you tell if they're short? Lift this knee up 90 degrees and keep the hip, you just relax. You keep the hip down on the table. You don't just twist. Keep the hip down on the table and push this way. So how much range of motion does he have? Yeah, 1% of normal. It should go down to here.
I could go.
It doesn't matter what you can do. Okay. The test is holding your hip. So if you do what you're doing, your hip's going to come up off the table and you're just going to twist.
Right.
Or if I just push like this, same thing. To measure the range of motion, you have to keep that hip immobilized, okay, and then push this way. So that's it. If I push any farther, your hip's going to move.
Okay.
Right. So when we loosen that up, it'll get lower and lower. So how you do that? Unfortunately, you can't do this by yourself when it's this tight. You need a helper. And so the muscle goes more or less this way, the piriformis, and the other ones go more or less at a 45-degree angle. So we keep this hip pinned down. You can't do this on a couch or a bed. It has to be on a firm surface. So we can do it on the floor or on a table. In lots of people, my patients now, if they really are tight, you can get a massage table from Amazon for like $150 now. So if you don't have a table, even if you don't have space for a table, you can get a fold-up one and stick it behind the door. So yeah, so hold the hip down and lean. I recommend, if you can, if you're doing like this, you get into this arm wrestling thing where he's not going to relax as well because we're kind of pushing back against each other. So the best thing is to hold this down and just lean on his knee that way. So I'll come around and try that. Yeah, so keep that down and just kind of lean. If you can, get your sternum on his leg. That's the best way. And just lean and push this way. Does that? So you got to keep this hip down. And she's not as tall as me, so it's going to be hard for her to go up high. Let's just try this. Just try putting both your hands up here. Just put that hand up here too. Keep this pin down and lean towards me. Keeping this pin down the whole time and lean towards me. Now, does that feel like what I was doing?
Yes.
So the hardest thing for you to do this, it'd be easier for you. I would show you how to do this on the floor. So it'd be easier for you to pin this down. Because most of the time, if you go home and it doesn't feel like anything's happening, it's because she'll forget to hold the hip down. Because it's hard to hold the hip down, but it'll be a lot easier on the floor. So who else has sore knees?
I do too.
Yeah, anybody else? No? Okay. Anybody else have? You can feel it. Yeah, so you can do that on the other side now. So when he's had surgery like that, if he can't bend, you just want to hold this up so that he doesn't bend any way it doesn't want to bend. But then you can do the same thing. Keep that pen down. And maybe if we have time, I'll show you how to do that on the floor because that'll be easier for you. So normal range of motion is like down here. And he may never get there, but if you do this every day for a few months, he'll get to here and then he'll get to here. It'll slowly improve. And if you just get So about 30 seconds at a time, and back and forth 3 times, at least once a day, and ideally 2 or 3 times a day. It's like if you do it 3 times a day, it's like 10 times faster results than if you do it once a day. It's like a logarithmic. So, yeah, because it's stuck like this 24/7. So the more frequently you interrupt that dominant state by doing the stretch, the faster you'll get the reliefs you want, and the muscles will physically get longer. And you can tell by that because the range of motion gets bigger.
So I want to continue to keep this pinned down and then.
So when she's doing this with you, you can't do it. You just lie here. She has to keep this hip pinned down and push it like that. So what happens most of the time when you go home and people come back, oh, it's not working. It's because they do this. They pin the hip down and then push this way. No, that doesn't work. You got to keep the hip pinned down the whole time and bend. And that's the hard part. But it'll be easier for you to do this on the floor. So yeah, we're going to show her how to do that for you on the floor. So who else has tight joints somewhere and wants to be stretched?
I typically get
Low back,
from here, like the side.
down your leg.
Yeah, I think it's when I sit a lot, or I am a leg crosser.
Okay, so this same stretch. Go ahead and just lie here. The same stretch helps for that too, because the hip rotators pinch the sciatic, can cause pain to go down your leg because of that. I do this stretch 90% of every visit when people come to me, even if they've been coming for years. Well, hopefully, if they've been coming for years, it isn't still very tight. But if they've been coming and haven't been stretching, I always check that at least. Eventually, my long-term patients do. Yours aren't that tight anymore, are they? Yeah. See, Martha's doing a good job. Eventually, it gets loose enough that you can reach and stretch it on your own, and then you keep it loose. But yeah, forget I said that about long-term patients. New patients, people have only been coming, say, for less than a year. It can take 6 months or a year to get full range of motion back if you do it every day. If you don't, if you do it once or twice a week, you'll still love it. It'll still relieve the pain, but you're never going to get the full range. You're going to be able to get the full benefit. So, but any little bit helps. So this is the bad leg. So we'll start with the good leg. So again, you keep this hip pinned down and see how far it'll go. All right. So she's got about 25%, 30% of the full range of motion. And you feel that stretching back here. So you'll feel it. The iliotibial band. Anybody heard the IT band? Oh, my IT band hurts. Yeah. Well, what causes that? The IT band is just a piece of ligament. It doesn't stretch. Ligaments don't stretch, but there's 4 muscles that attach to it up in your hip. One in the front called the TFL, the piriformis, and the glutes. They attach to that ligament. So anytime you have tension there, it's because one of those muscles is tight. So yeah, you'll feel it wherever it's tightest. But yeah, just hold this down. Do you have somebody at home that can help you do this?
Yeah.
So yeah, just got to get somebody at home to keep this pinned down and push that way. That's the first one. So straight across for the piriformis. And you might only feel it on the side of the hip now, but eventually you'll feel it in the upper glute area because that is the muscle that actually lets go. Yeah. So you do it straight across first and then kind of towards the elbow. You want to go whichever angle is the most restricted, right? So for her, that's about right here. So the second time I'd go back and forth straight across, and then the second time do it like this, sort of towards the elbow. People love to say, oh, look, I can stretch it way up this way. So what? You can probably stand on one leg too. That doesn't do anything. It's not tight that direction. So you find the direction. And with all the stretches, the direction that's most difficult is the one that needs the most attention. So that's, people don't want to do that. I don't want to do that one. People go to yoga classes with mirrors in them so that they can do pretty poses that look like the book or whatever. Don't do that. You need to find the stiffest parts of your body and start with those and then unwind. And you don't need to do 20 stretches. If you're going to stretch for a half hour, I usually give people 2 or 3 stretches to do for a half hour. Do them for 10 minutes each. Don't go to a Bikram heated yoga class that artificially overheats your muscles without working for that heat, generating that. If you go to an Iyengar studio, he'll say if you want to get the benefits of being nice and warmed up, do 104 sun salutations or move your body in some way to generate that heat on your own. Because you can injure yourself if you're in a hot room and someone comes and pushes you, you don't know where your limits are now because you've sort of artificially melted your joints a little bit. So it's much better to generate that heat on your own and find this part that's the tightest and focus on that first over and over and over again until that gets looser.
And that would help with, because my daughter, she does a lot of basketball. She's been complaining about like knee pain here and knee pain here.
Is she going through puberty?
That's right. She's
How old is she?
She's gonna be 16.
Okay, well, so athletes and people that are going through puberty start to grow faster, and they get see this bump right here.
Yeah.
That's where the ligament from the quadriceps attaches. It goes through the patella and attaches right there. So if you're overutilizing those, especially when you're young, then that starts to get thicker because you're putting more tension on it. And the bones are literally the shape they are to hold the muscles that are pulling on them. So there's bumps all over your bones, and they're there because some muscle is pulling on that spot. So you need more bone there to hold it. So if she has that, then she probably needs to stretch her quadriceps more. Just see if she can touch her foot to her butt. And if she can't, then she needs to stretch those. And if her knee is still irritated, it'll probably help to do those too. Just lie on the floor, do the same thing I just did. Hold the hip bone and see if it's tight. See if it'll go across or not. And if it doesn't, then you do that stretch. So who else has a tight spot they'd like to learn how to get looser? Neck? Yeah. So let's see. Yeah, we're gonna come over here for that. So if you have arthritis in your neck, if you have a lot of tightness in your neck, the best thing to do is go to a non-force chiropractor and get your neck directly loosened up. Because absent that, you're never going to get this. You can't loosen up your neck by yourself. You never want to crack your neck. If it pops a little bit when you're just stretching normally, that's okay. It's not going to hurt anything. But in addition to the muscles along the spine, the trapezius muscles here get really tight, and then there's a whole bunch of muscles that cross the shoulder joint that get tight too. And because of that thing I was talking about earlier, everyone's stuck like this. If you do this, it loosens everything between your head and your fingertips. So just mirror me, stand with So just you can put your hand here. Yeah. So stand straight. So don't do this, right? And bring the other hand up. So make sure your weight's balanced on both feet. And you want this hand higher than the shoulder. So step towards me just a little bit so you can spread just a little bit so you can spread the fingers as far apart as you can. Have the middle finger pointing straight up. And you guys can come over here if you can't see, if you want to. This is a really useful stretch for almost everybody's tight here. This is a stretch I recommend everybody do for the neck and shoulders. So fingers as wide as you can get them, hand always higher than the shoulder. And if anything is really sore, sometimes people are stuck like this. If you can't get your shoulder down, you need to move the hand higher because then it will release and start to drop down. So you lift the sternum up. You say you go to yoga class? No. Oh, so in yoga class they talk about all the time. Lift the sternum up, pull your shoulder blades down, sink the weight into the heels instead of the balls of your feet. Feel the weight in the heels. Lift this up, pull the shoulder blades down, and stretch both hands out as far as you can. So push that hand into the wall, and you're going to feel something tight somewhere.
I'm hurting right here.
Interesting. Okay, step a little closer to the wall.
Okay.
Yeah.
But then this bends.
But just move just far enough away that doesn't bend. And you can let this hand down now. So when you do this, you're stretching the flexors on your fingers, your hand, your wrist, your elbow, your pectoralis muscles, the chest muscles. You're stretching all of these, but you have to push against something. You have to push against the wall. And so if you do all that, eventually you'll start to notice it'll feel tight here one day. It'll feel tight here one day. You'll feel it in your neck. The beauty of this stretch is you do it the same way, and whatever part needs to stretch, that's where you'll feel it stretching. You just keep doing that over and over and over again, and that will release. And the beauty of this is you can do it anywhere. Anywhere there's a wall, a tree. If you're going on a long drive and you stop for a break and push on the side of your car, anywhere you can find something to push against. Yeah. And always do both sides. Same thing, both sides, switch back and forth 3 times.
Okay. I was told not to have my neck worked on at all, and I was also I have
because
of the arthritis in my neck, and then I have lots of grinding all the time. It just sounds like it's grinding.
Yeah, so if you have severe arthritis in your neck, you might be told never to go to a chiropractor because you don't want to get your neck cracked.
You said to work on the back part, but not the neck because of what's going on in my neck right now.
Yes, you definitely wouldn't want a traditional adjustment because, without seeing your neck, most chiropractors wouldn't, without seeing some x-rays, and with that case history, most chiropractors wouldn't crack your neck either. I don't do any cracking, so what I'm doing is releasing tension from your muscles, kind of like the stretching, but on the table directly with the ways I hold it. There are ways to release tension from the nerves that control those muscles. There's a membrane that surrounds your brain and the spinal cord that you can release tension from that. Helps all of your muscles relax better. So yeah, there's always a way that you can, without cracking your neck, release even if you have severe arthritis. And then the stretches will be more effective.
What's your thought on bone density?
It's a good idea for anyone to do it, yeah. And you take adequate vitamin D, K2, good calcium, not calcium carbonate. Most store-bought calcium supplements are crap because they're calcium carbonate, which is ground up rocks and seashells. So look at your vitamin labels. If it has calcium carbonate in it, throw it away. You want good calcium because the calcium carbonate can increase the hardening of your arteries. If you take a lot of vitamin D and keep calcium carbonate in circulation, there's even a study that came out, nobody should take Either you're taking too much calcium or too much vitamin D. No, you're not. You're just taking lousy calcium.
Why do they say not take calcium 2 days before your bone density test? Yes.
Because it's gonna affect the result a little bit.
Oh,
Yeah.
yeah. What is
I don't know. I don't actually know. That's why they think it's going to. So, but
Oh.
yeah, what would be the mechanism of that? It's not going to be deposited. I don't honestly know. Somebody must have tested something.
They want a more positive result because they told me the same thing.
Yeah.
I have my bone density test in a couple of weeks.
Yeah.
They said stop taking calcium 2 days before.
They want to see, what the state of your bone is without any extra nutrient support. I doubt that it makes that much difference.
Well, I want it to be positive side, so I'll probably continue taking the calcium.
Yeah, I mean, you can start taking it right after. It's not going to make that much difference to stop it for a couple of days anyway. Yeah.
And I'm taking
the reacted calcium.
the reactive
So yeah,
calcium.
so similarly, there's benefits to having more than one form too. So orthomolecular's reacted calcium is the one I've been using for 20 years. I've had lots of patients that went from osteoporosis back to osteopenia, or from osteopenia back to normal bone density after a couple of years. The reason they only do the bone density test every 2 years is because it usually won't change any sooner than that. But when you're on these nutrients, it might change in a year. There's also a couple of other tests that measure the activity of collagen that you can test at any time. You can test in 3 or 4 months to see if that's helping too. But yeah, bone density test is great because it has a teeny tiny amount of radiation, but you get more radiation just walking around on the surface of the earth every year than you get from a bone density test. So it's a negligible amount.
What is your thought on plant-based?
So most of them don't work. Those are some of the ones that I tried for years, and it doesn't hurt to try it. But the good ones all come from animals, the ones that seem to work the best.
Animals.
Yeah, chickens, shark, bovine. Those are the main ones. Yeah. No animals are harmed in the making of collagen, or no animals die to make collagen. Just like no animals die to make leather. They die for the cows die for their beef, and the leather is just might as well use it, right? So same with their joint tissue. Might as well use it. Why throw it away?
So
Who else?
If I'm taking your collagen,
Mhm.
collagen here, and the
Yeah, so that has three types of collagen. The calcium has 4 types of calcium in it.
okay.
And one of the most important ones that's often not in store-bought calcium is hydroxyapatite. And that is from sharks.
Taking both of those.
Mm-hmm.
So I'm keeping my fingers crossed that the bone density test
Yeah.
in July.
Okay.
Comes out.
So when you get that test, see how you do, and I can muscle test to get a better idea of what doses specifically do you need of all those nutrients to give you the best shot at improving it. Great. Lauricidin. That's for the immune system. It's a single ingredient. It's called monolaurin. Is the only thing in it. Monolaurin is in human breast milk. It helps set up your immune system when you're born. But then when you stop breastfeeding, you're not getting it anymore. There are tiny amounts in coconut. It takes a huge amount of coconuts to make 1 jar of that stuff. So, drinking and consuming any coconut product will have an insignificant amount of lauricidin in it. But that product is great because it never goes bad. It's the consistency of soap. So it's impossible. You just keep it in your cupboard, take it whenever you're sick, or if you have an immune condition, when you come in to see me, I'll recommend that you take it, for a few months.
Is it like colostrum?
No.
No.
Nope.
Totally different.
Totally different. Yep. Both support immune system. Yep. You can take it anytime. You can feed it to an infant. The only side effect you ever has, does anyone know what a Herxheimer reaction is? So if you're taking anything that helps your body kill off bacteria or viruses, or helps your body flush out toxins, if you do that faster than your stomach, your intestines can flush that stuff out, then it will remain in there longer than usual and make you feel like you're getting a stomach flu, make you feel achy, a little nauseous, a little dizzy. That's when you're pulling toxins out of storage somewhere in your body faster than you can excrete it. And so that can happen if you take too much lauricidin. It doesn't hurt anything. You just might feel miserable for a day or two. Then you back off. So normally I just recommend people start out with 1 scoop, sometimes 2. But you can give a quarter of a scoop to an infant. It's safe for even kids to take. And very, very helpful. So again, how do you know it works? Tests. So a lot of people, I test a CBC on everyone. Most doctors ignore your white blood cell count unless it gets high, because that's when you have an acute infection, right? Your body's ramping up white blood cell count to fight off that bug. Well, what if it's low? Most doctors ignore that completely. The range should be, it's usually somewhere in the 5. The low end is 5 point something. but it can be in the 4s or even the 3s. See that all the time. And that means that your immune system is not keeping up. There's something causing a drain constantly, and it's usually a bug in the gut, sometimes in the gums, sometimes in the sinuses. Well, if your sinuses feel fine and your gums don't hurt, it's usually in the gut. Too many bad bacteria, not enough good bacteria in your gut. And so this helps fix that. And your white cell count will go back up. Every time somebody has a low white cell count, I give them that, sometimes some other things too, and it almost always works in a few months.
Good.
Yeah. Who else has a joint issue that they're curious about?
So I have a question. So the other day, yesterday, I was laying down in bed, and then all of a sudden I was going to get up, and I got a kink, and then I was like, oh, and then I couldn't. The rest of the day was like hard for me to move.
Yeah. So you probably need your neck checked. Again, there's tight muscles. The nerves that control those muscles can become impaired so that your brain can't communicate. All these tight muscles are still hardwired to your brain, and it's a waste of energy to stay that way. But your brain also wants to err on the side of caution and protect you from a perceived threat. So muscles tighten up, and then they just get tighter and tighter, and add some stress and lousy posture, and it just gets worse and worse. That's always reversible to a certain extent, if not completely, because they're still hardwired to the brain that sensation is potentially able to be restored. And then your brain will realize that it doesn't need to hold that tension there anymore. And then you can do some stretches and some things that I do on the table to directly release it, to facilitate that and get you to the point where just the stretching will keep it loose. By doing that, there's another really good stretch for the neck and shoulders. Does anybody want to learn a stretch for their neck and shoulders?
Yeah.
Who's the volunteer?
Right here.
Right here? Well, we did you already. Somebody else. Candace? Okay, so if you have a table, just lie on your back here. Especially if your shoulders are mostly rolled forward, you can often see that on people. If you have a table, or you get one, I'll slide this pillow back just a little bit. Yeah, that's good. And you just stick your fingers, come around here. If you can't see, you just stick your fingers on somebody's shoulder. So ideally, there would be no space here. Your shoulders would just be down here on the table. Very few people older than their 20s have that, but you can get there by the stretch I'm going to show you. So when that's rolled forward, that's one way to tell. And if you push like this, there should be a certain amount of give. If the muscles are really tight, there'll be less give. It'd be hard for you to tell what's normal, but this isn't, right? Can you feel how that's really tight there? Yeah, it's really tight. And you can see that this is really tight because those are up here instead of down there. So it would feel really good to both push the shoulders down towards your feet and towards the floor. And so if you have a table, you can do it like this. It's much easier for the person doing it, for the person who's not the patient. It's easier to do it if you have a table, because then you can just you're mostly using the heel of your palm just inside the joint, so you don't put too much pressure there. Like this, and you push the shoulders down towards the floor and towards the feet, like that. Does that feel good? Mm-hmm. So I always start out really gently, because you can overdo it in the beginning. Put too much pressure, it might hurt the shoulder especially. But yeah, just a little bit of pressure like this. Hold for about 30 seconds, and you wait, and it'll slowly start to release. Eventually, you'll even feel that. Oh yeah, it's dropping down a little bit. And then eventually, if you start doing this every day for, after 2 or 3 weeks, you can push harder, and it'll feel good to push even harder, because they're pretty tough muscles. But in the beginning, you always want to start light, just enough pressure to feel like something's happening, but not so much to irritate the nerve endings, because where the muscles are attached, that's where all the nerve endings are, and that's what they get irritated because the muscle's tight. So if you stretch it, that's going to increase the tension on those same nerve endings. So you have to be careful of that. But eventually, you take the constant pressure off of those nerve endings by making the muscles longer and looser. That still feel good? Mm-hmm. Yeah.
That feels great.
Yeah, so that's one way to do it. And there's another way you can do it sitting up with a yoga block.
Should I sit up?
Sure.
You said you have to hold it for like 30 seconds?
Yeah, 30 seconds, a minute. Eventually, as long as it feels good, eventually you can hold that one for a couple minutes even, it gets looser and looser, and it feels good to just hold it. The person will say, just hold it forever. Oh, you could do, patients say to me, oh, you could do that for an hour, that kind of thing. So let's have you sit over here. So just sit on the floor about this far away from the wall, facing away from the wall. So I usually don't, I have to be careful doing this too, because if somebody's really tight here, then putting this block and bending back against that might hurt. So is your back tender here?
No.
Yeah, no, that's not that stiff there. Yeah.
That's fine.
So people, their back curves this way, right? And you're facing this way, your back curves back, right? So you find the spot that's sort of sticking back the most, or, you figure It's roughly going to be an inch or two above the bra line, typically around there. That's usually where it pokes back the most. So you put the top of the block, you put the block the long way, not any other way, like a beam sticking out of the wall, and you put the top edge just below the part that sticks back the most. So you're going to have to scoot back about 3 inches. That's good. And now lean away while I place the block. Put the top of the block. Does anybody see that? Put the top of the block. Just lean away a little bit more so I can place the block. Yeah, not quite. Yeah, that's just hold right there. Okay, you got to place the block right there and make sure it's centered left to right. Yeah, and then just lean against it like that and just relax. Just
Is it straight against the wall?
no,
Oh, I see.
it
It's on a
moved.
curve. Oh,
It's,
yeah.
it's not centered.
Yeah. Kind of like.
Yeah, there we go. Yeah, the block is against the wall between your spine and the wall. So remember, when we're on the table, we're pressing the shoulders down towards your feet and down towards the floor. So the same motion, but the nice thing with this, and this is a stretch that I invented, because most people that are stuck like this are also hunched forward. So as long as their back isn't too tight there, then this gets the shoulders down and back, and you get the extension in the middle back all at the same time. So this one, same thing. You want to stay off the Sorry.
I don't know what to do with my neck.
Just relax. You don't do anything. Just be slump. You can even slouch. Totally fine. Yeah, don't try to help. Don't try to sit up straight or anything like that. Just slouch normal. And so you have to be careful to not push on this joint. Have you ever heard of a separated shoulder? That's the AC joint where the collarbone and that part of the shoulder attached. So you don't want to push on that because that's sensitive. You want to use the heel of your palm and get in behind that. So can anybody stretch their thumbs down this far? Well, so you can almost. Most people can't. If you do that stretch hand against the wall over and over again, it'll eventually get there. So if you can do that, then it feels nice to put the hands in front. Just promise them you're not going to choke them. Most people can't do that, so you can just keep your thumb with the rest of your hand and come in like that. So the same thing, you're going to gently. You want to have your legs and arms straight, because if you're bent, then you're arm wrestling again. You're pushing, and she's going to push back. She won't relax as well. So arms and legs. It's awkward. People don't want to do this. Oh, that feels weird. I look stupid. I don't want to do that. Do it anyway. If your arms and legs are straight, then it's just body weight leaning, and that's much more relaxing for the person receiving. I'm just pushing down towards the floor and back towards the wall. Just a little bit. That feel good? Feel really good?
Yep.
Yeah. So everyone likes this. If you do it correctly, it feels great. No. Foam rollers are okay, but they're mostly kind of like a deep tissue massage. They're forcing tension out in certain areas, so you get that immediate relief, but your body doesn't really learn anything from it. So this is flooding the brain with feedback from the trap muscles, from the chest muscles, and from the muscles in the middle back, making it aware of all these places it's holding tension that's not necessary. There's no damaged tissue there that has to be protected until it heals. It's just wasted energy. Was useful at some point, but not anymore.
Whew, right here.
Yeah.
I ain't gonna hold a lot of tension there.
Yes. You and everybody else, most people are tight there to a certain extent, one extent or another. Anyone else want to do that one? Want to see what that one feels like?
I'll try it.
All right, you're closest. All right, so let's pair up. So let's get this out of the way. That was my plan, is to have everybody pair up and do several things at once. So find a partner if you want this stretch.